Hello everyone, welcome back to Medical Coding Club. This is Chandrika. So today let's discuss a few important questions from respiratory and cardiovascular system. So as you all know, you will be getting 6 marks questions from 30K series. Okay, 30K series belongs both respiratory and cardiovascular system. So totally you will be getting 6 marks. 3 marks from respiratory system and 3 marks from cardiovascular system. Okay, so the procedures are little complicated, so that you need an extra attention to this particular chapter. So respiratory system is very easy, which is like a direct, straightforward procedure coding. Compared to cardiovascular. Cardiovascular involves too much knowledge in procedure terminology and the complete cardiology system. Okay, so here I have taken some repeated questions, about 10 to 12 questions. So I'll discuss all of them today. So let's begin. So first question, you can see here a 26 years male patient with a deep laceration from the kitchen knife to his right hand, and the surgeon washes the open wound with the sterile clamps are applied. The provider cleans the vessel and prepare the edges of wound, and she then repairs the bleeding vessel. Okay, bleeding vessel with sutures. The clamps are removed. Provider uses a Doppler probe to check the blood flow pattern through the repaired vessel, and what is the CPT code is reported. So this is a cardiovascular section. So here before discussing the answer, I'll just give you an overview. What are the things that you should go through? Like, what are the concepts that you must refer from the cardiovascular is? See here, from the cardiovascular system, you must refer CABG concept and cardiovascular interventional radiology, that is CVIR procedure. In that, non-selective catheterization and selective catheterizations are important, and mainly selective catheterization is very important. Okay, and then a CVAP procedure, that is central venous access procedure, and then pacemaker and defibrillator. So either they'll question about pacemaker or defibrillator. Okay, both are important. You should know what are the components will be there in pacemaker as well defibrillator, and if they are only removing electrode, or if they're only removing pulse generator, or if they are completely removing the entire pacemaker, how to code everything, each and part by part you should be aware. Then easily you can secure marks in pacemaker and defibrillator also. And then aortic aneurysm repair. Okay, so these are some 5 definite concept. So you should go through all of this. Just go through the code range and understand the basic procedure terminologies and how they exactly they'll perform. And also in CABG, you should be aware vein grafting and artery grafting and combined grafting. Okay, artery plus vein graft, you will code artery as a primary code, and to code venous graft, you will be utilizing the add-on codes. Okay, and also you should be aware of the harvesting coding guidelines. Okay, from which vein, if they harvest, it is an included procedure, and some few veins are excluded from the vein procedures. Okay, same way artery also. Radial and ulnar arteries are excluded from artery procedure, so that you have to code whenever they harvest artery from those arteries. Okay, separately. CABG one code and harvesting one code. So likewise, I can give all the overview on these particular sections. So now let's come back to our questions. Yeah, so here I have highlighted. She then repairs bleeding vessel. Okay, so they are repairing the blood vessel. Okay, so you can just go ahead and check the options, and I am going to directly jump into the right option. Okay, so I can save some time. So you have to pause the screen, and if you really want to learn, you can go through all the options and you can finalize your answer. Okay, so now we'll see the correct answer. I'll show through book. Yes, so you can see here, repair blood vessel other than fistula with or without patch angioplasty, So from here, if you see 35201, it says repair of blood vessel. The location is neck. 35206, it is for upper extremity. And 35207 is hand or finger. Okay, hand and finger. 35211, intrathoracic with bypass. So, check the location in our question. So the location is right hand. Okay, so right hand. So then right hand means your correct answer should be 35207. 35207. Okay, 35207 is the correct answer. So this is again an important repeated question. So I hope you got a little insights on this particular question. So next we'll move to another question. So the obstetrician remove bilateral external iliac and internal iliac and abductor nodes laparoscopically for total pelvic lymphadenectomy and periaortic lymph node sampling. What is the CPT code? So here they are performing pelvic lymphadenectomy procedure, and the approach is important. The approach is laparoscopically. Okay, that is laparoscope approach. So now again we'll check the correct answers. So you can see, using laparoscopy, they are performing lymphadenectomy procedure. Okay, under lymphadenectomy, you have to check the approach, which is laparoscope. And under laparoscopy, you have to check for pelvic lymphadenectomy. Okay, so you can see here, you can just navigate all the codes. So just compare between 38571 and 38572. In our question, what are the options we have? Yes, we have 38571 also and 38572 also. So let's see what is the answer. 38571 says laparoscopy with bilateral total pelvic lymphadenectomy, and 38572 says with bilateral total pelvic lymphadenectomy and periaortic lymph node sampling, okay, which is nothing but biopsy. For the complete question, along with the pelvic lymphadenectomy, they are also performing periaortic lymph node sampling. Okay, then you should choose the right answer as 38572. Okay, 38572. And if you see the code description here, it clearly mentioned bilateral. Okay, CPT code, primary code description itself saying bilateral. Hence, you don't have to choose option with the modifier 50. Okay, so for this particular question, correct answer is option D, 38572. Okay, so let's see one more question. The patient has a ruptured aneurysm in popliteal artery. Provider makes an incision below the knee and dissects down around the popliteal artery after clamping and the distal and proximal ends of the artery. The provider cuts out the defect suture of remaining ends artery together and places the patch graft. So here the artery name is important. Okay, so you just have to check ruptured aneurysm for this particular artery. So let's see what is the answer. And options you can see here, 3535 series we have. So you can see here graft insertion and aneurysm. So under aneurysm you have to navigate. So according to the options, we have 351 series, 35152 and 35151. Refer these code first because these codes are falling in aneurysm 351 series. Okay, So what exact keyword we have? That is ruptured aneurysm, and for this particular artery. Okay, so you have to just check this sentence. So let's go back. Let's see what is the description of 351, 52, and 51. Yeah, you can see here 35142 for ruptured aneurysm, common femoral artery. And same way 35151, this is for aneurysm. Okay, this is only for aneurysm and the popliteal artery, but here there is no rupture. Okay, in our question they clearly mentioned ruptured aneurysm. So if you check 35152, here it says for ruptured aneurysm of popliteal artery. Okay, so this is the correct answer. 35152 is the correct answer for this particular question. Okay, option A is the correct answer. So next, you can see a CABG question here. I don't think CABG. Let's see the overall complete question. Patient is 75-year-old male with a coronary artery disease. 2 days ago, patient underwent CABG of graft 4 for coronary disease and now present to the off with significant bleeding. Okay, significant bleeding is nothing but hemorrhage. So this is like post-operative hemorrhage. Why? Because just 2 days ago they did CABG procedure. Post CABG patient is experiencing significant bleeding. Okay, so this is post-operative hemorrhage. See, after CABG procedure, patient may develop infection or thrombosis, okay, or maybe a bleeding. So here in our question, bleeding is the complication, and then an echo has been obtained and the decision has been made to perform a re-exploration for bleeding and washout going through at the incision of previous operative site. So again, they are performing exploration procedure, but for which reason they are performing exploration? It is to treat the hemorrhage. Okay, so let's see the options: 35800, 3211, 358, 321. So I will just eliminate option B and option D. Okay, so option A and C you need to refer 358 series, and because this is the code range falls in 358 series only, the scenario what we are seeing here. See, if you're already aware of the code and the code range of the particular concept, it will be easy to eliminate options. So you can see here transposition and excision, exploration, repair and revision. Under this you need to check. Okay, so 358 series, 35800, exploration of post-operative hemorrhage, okay, or thrombosis or infection of neck. So this is what I was mentioning. Post-operative is nothing but after a particular surgery. Okay, CABG they have performed. After 2 days, patient has developed hemorrhage. Hemorrhage is a post-operative complication. 35800, which is neck location, and 35820 is the chest location. 35840 abdomen, 35860 is extremity. Okay, so in our question, I think this is for chest. Okay, so 35820, 35820 you can select, and if they specify the location as neck, you can choose 35800. Okay, since it's a CABG procedure, you can consider 35820. Okay, this is the right answer for this fourth question. And next question we'll see. The provider places tunneled pleural catheter for patient with malignant pleural effusion what is the CPT code is reported. So this question is not complete. Here they have just given a keyword. So they are saying provider placed a tunneled pleural catheter for which purpose of the patient who is having malignant pleural effusion. So we can see here, you can just check the answer for tunneled pleural catheter. So as you can see here, the question is about introduction or removal. Okay, so here places is nothing but introduction. They are introducing catheter. Okay, so we have to take code under introduction procedure. So if you check under introduction, the tunnel placed 32550 says insertion of indwelling tunneled pleural catheter. Okay, so this is the right answer for this particular question. 32550. The provider places tunneled pleural catheter. 32550 is the correct answer. So 32552 is removal of indwelling tunneled pleural catheter. Okay, one is 32550 is for insertion. Same way 32552 is for removal. Okay, but in our question, the question is about places. Places is nothing but insertion. So you have to select 32550 as your answer. Next question. A patient, so you can suffers, this is suffers, okay. Patient suffers a non-ruptured intrarenal aortic aneurysm. So see here, this is non-ruptured intrarenal aortic aneurysm. So when you are referring aneurysm concept, renal aneurysm, check whether they are saying ruptured aneurysm or non-ruptured aneurysm, because code will vary on that particular node. So as I can highlight here, the question is about non-ruptured intrarenal aortic aneurysm. So you can just read the remaining question. So to correct the position, what CPT code does the vascular surgeon use to report the procedure? So we'll see option, that is 347 series. So you can see here, this is for aneurysm, AAA. Okay, you can just navigate. So I'll just show the codes from 34701. 34701 is endovascular repair of infrarenal aorta by deployment of an aorta-aortic tube endograft, including preposition. So you can just see the remaining description of the code. Coming to 34702, this is for rupture, including temporary aortic or iliac balloon occlusion. So easy here. The question is about aneurysm and non-ruptured aneurysm. Okay, if you see 34702, it is about for rupture, and hence 34701 you can consider it for non-ruptured aneurysm. Okay, non-ruptured aneurysm. Apart from these two options, you can also refer other option like 34707 and 708. So 707 and 708. So this is again, like you can read the description, supervision, interpretation of this pseudo aneurysm. Okay, no, it's these two are not correct. Okay, you have to, for intrarenal, you have to refer these two, 701 and 702, and the question is about non-ruptured, so you can select 34701 as your answer. Okay, 34701 is the correct answer for this question. And if they mention ruptured, then you can select 34702. So next question. From left femoral axis, the catheter is placed within the proper hepatic artery. Dye is injected and it is obtained. A stenosis within an artery is identified. Percutaneous transluminal angioplasty is performed for the proper hepatic artery in an outpatient radiology department. Okay, one a proper hepatic artery, common hepatic artery. This is common, actually common hepatic artery, and one more is hepatic visceral artery. Okay, so this procedure is catheterization procedure. Okay, selective from left femoral. So they are selectively, selecting the branch of the artery and then they are inserting catheter. Okay, this concept we call it as selective catheterization. So in selective catheterization, you already aware that you will keep 362 common. Okay, and fourth digit and fifth digit we will have the guideline. Fourth digit is based on the artery is above abdomen or below abdomen. If it is above abdomen, you will take 362 1 series, and if the artery is below abdomen, you will take 162 362 4 series. Okay, for below abdomen. And then fifth digits are based on the order entry site. Okay, order entry site in that vascular family. Okay, in the vascular family, you will check the order. Okay, the particular artery falls in which order, and for the order, according to the order, you will put the order number. Okay, say for example, for second order, it is 6, and third and beyond third order, we will give order entry site as 7. Okay, so in our question, the two hepatic artery and another artery they have given. So you can just take time and navigate all the options. Okay, so here even if I explain roughly, you may not understand. So I'll just orally refer. See here, common hepatic, which include proper hepatic. Okay, so these falling in second order. Okay, second order means 36246. 4 why I am selecting? Because common hepatic is below abdomen. So 4 I am selecting, and 6 I am selecting because it is in the second order. And same way, one more artery we have, that is proper hepatic. So I think, yeah, so common hepatic is in second order, proper hepatic in third order. So for third order, we will select 36247. 7 is the order entry site for third order and beyond third order. Okay, so these two codes are correct for selective catheterization. So let's see the options. Do we have any option in these two codes? Three six two four seven and three. Okay, 37246. Yeah, 47 we have, that is, this is for proper, as they mentioned, within the proper hepatic artery. This is falling in proper hepatic. Yeah, it is in third order. Okay, that is why 7 is correct. 36247 is correct. 36247 is correct. And you have option also 36247. And then 37246 is your angioplasty code. Okay, angioplasty code, I think. Yeah, percutaneous transluminal angioplasty. And then for radiology, for outpatient radiology department, professional service you can use, and check this code description. Okay, I did not note down the page number. So hopefully option is D. So the correct answer is D. So you can just check all other options and you can navigate. Then you can comment if you find another option as a correct answer. Okay, so you take time and you check properly. Next, an oncologist performed 2 bone marrow biopsies on the left posterior iliac. Okay, so this is bone marrow biopsies. Okay, they are taking bone marrow biopsy. So how many biopsies taking? 2 biopsy. So then you have to check the code under bone biopsy 382 series. Okay. Bone marrow or stem cell services 382 series. So 38220 is diagnostic bone marrow aspiration. Okay. In our question, they are performing biopsy, not aspiration. So 38221 bone marrow biopsies. 38221 is correct. And if they perform both biopsy and aspiration, you can select 38222. But in our question, only they're talking about biopsies. So you have to select 38221. Okay, option D is correct for this particular question. 38221. Next question, a 6-year-old requiring ECMO. Okay, for ECMO requires open insertion of peripheral cannula. So here cannula insertion. Okay, so when you take ECMO procedure, here there will be 3 different scenario. One is cannula insertion, cannula reposition, and then lastly cannula decannulation. Okay, decannulation is nothing but a removal. So they are questioning about insertion. So in ECMO procedure, approach is important, and also patient age is important. Patient age and which approach they are performing procedure and what exactly they are doing. Okay, these 3 will make you to choose correct answer. So option you can see 38881948582. So I'll show the codes. So ECMO. So when you get ECMO procedure, please come to this table. Okay, easily you can able to get. So firstly, they are doing cannula insertion procedure and patient age is 6 year. Okay, 6 year. So next you have to check what is the approach. Is it percutaneous or open or thoracotomy? Okay, so this is requires open insertion. So open insertion means answer should be 33954. Okay, for 6-year-old patient using open approach, they are inserting cannula. So answer should be 33954. Option B is correct. 33954 is correct. So next, in this cannula, you can also see here, subsequent is nothing but cannula reposition and then decannulation. Okay, so whatever the procedure they may do, the other things, approach and the age criteria, you have to check and then you can easily select the codes. Okay, so this is about ECMO procedure. So for 9th question, option B is correct. So next question, a 62-year-old with a heart block needs reimplantation of dual chamber pacemaker. It is reimplantation. Okay, not the initial one, but it's a like they are removing and replacing with a new one. That is why they are mentioned as reimplantation. So for the dual chamber pacemaker, and the entire system with the transvenous, atrial and ventricular leads were removed. So you can see transvenous, atrial and ventricular leads. That means it's a dual chamber pacemaker. The completely new system of transvenous, atrial and ventricular leads were inserted. So they removed dual chamber pacemaker and they replaced with the dual chamber pacemaker. Okay. So as I already mentioned earlier, whenever you are coding for pacemaker and defibrillator, the component is important. Okay. Pacemaker consists pulse generator and electrode. Pulse generator is nothing but battery, and electrode like wire. So all those will be one another compartment. So now you have to check what exactly they are doing. So in our question, they removed complete system itself they have removed. So whenever you are referring pacemaker, so you can just come to pacemaker simplified table. So here is the table where you can get the simplified description of pacemaker and defibrillator. Okay, so first we will find out the code for, you can see it, removal. Okay, first you can removal of electrode we can give. So if you check removal and replacement of pulse generator and transvenous electrode, removal and replacement of pulse generator. So here we have these codes 33233, 234, 235. So you can just check what are these identified or unique description of these codes. So let's see, 33233 says removal of pulse generator only, and 33234 says removal of transvenous electrode only, single lead system. So single lead system we don't need because in our question they clearly said it's a dual chamber. Next, 33235, here is a description, removal of transvenous electrode only, dual lead system. So dual lead system we need, so you can take this code also. So overall you can take removal of pulse generator code because they are removing battery and they are also removing the electrode. So first we can code for removal. So what and all you have to code? 33233 and 33235. So this is for removal. Now you have to code for insertion. Okay, removal and replacement. Now you can just code for insertion of entire system. So if you refer 33208, in initial pulse generator insertion or replacement of pulse insertion of transvenous dual leads. Okay, 33208 is correct. So you need 3 codes now. So all the 3 codes are there in option D. Okay, 33235, 33208 and 33233. So 51 modifier we will utilize in this pacemaker coding. So note down the answer. Same way, if the question same dual chamber removal and replacement of defibrillator, you will come here. Okay, so same concept you will follow. Removal of pulse generator 33241, removal of transvenous electrode, dual lead system 33244. Okay, this will give you a removal code, and for replacement, for a new insertion, you will choose 33249. Okay, this is for defibrillator. So both are important. Anything can be asked, but most of the time they will question only this, removal and replacement, removal and replacement. So this is the method that we code. First we will code for removal, and then we code for replacement. So option D is correct. So next question. Patient had a, okay, this is again a big question. So I'll leave this question for you. I've highlighted few things. So just read the complete question, and whatever the thing I have highlighted, you can navigate and you can comment your answer. Okay, and one more question I will discuss that is again important. So this one, mother brings 2-year-old son to the pediatrician office because he stuck the bead up his left nostril. So here the doctor is removing foreign body from the nostril. Okay, from nose location they are removing the foreign body, and where they are removing, it is in the office setting, pediatrician office. Okay, so you have to check. Nose procedures are very important, like nose incision, excision, like excision of nasal polyps, and the other things like you can see here, this nose incision is important, excision is also important. And then coming to introduction, so then removal of foreign body and repair. Repair include rhinoplasty, primary, which includes few parts, but when it say complete, rhinoplasty complete, it includes all the external parts as well, a bony pyramid and lateral and alar cartilages. So our question is about removal of foreign body. 30300 says removal of foreign body, intranasal office type procedure. Office type procedure is like kind of simple procedure where they can easily remove the foreign body using forceps. Okay. And next 30310, it says requiring general anesthesia. So here patient needs general anesthesia in order to perform the procedure. Okay, this is like little complicated. Patient may not tolerate to the procedure. That's why they may go with a general anesthesia. Next 30320, this is bilateral rhinotomy procedure. Okay, lateral rhinotomy procedure. Both these things can be conducted or can be performed in hospital setting, whereas using forceps, that if they are removing, you can consider it as a prophy, like physician office they are doing. So now our question, it is pediatrician office. So answer should be 30300. Okay, 30300 is the correct answer for this particular question. And the thoracoplasty is also important. In thoracoplasty, two like methods will be there. One is rib resection and one is the skid type. So you have to check on which type they are utilizing and they are doing the procedure. So I'll show. So thoracoplasty, resection of ribs is 32900 and the skid type is 32905. So in our question, it is option C, 32905 is correct. Okay. So that's all, guys. I hope everyone understood whatever the question I have explained. I think one or two question I may not explain. You please go through, you just navigate and check all the options, and you will able to get the answer. Okay. So yes, these are the important questions, repeated questions from respiratory system, and most of you are messaging me in WhatsApp that saying that you are getting questions that what I am discussing in the YouTube. So I am more than happy. Okay, so I think day after tomorrow, or maybe tomorrow's weekend, yeah, maybe day after tomorrow or Monday or Tuesday, most probably I'll upload digestive system important concept and the questions. Please go through on that note also. And so yes, that's all. Thank you for watching. Please do subscribe to my channel and please do share with your medical coding friends. It will be helpful for me to create more content. Okay, so thank you all.